It's day 3 of the Douglas County budget hearings. We're sorry for those of you who are online. We're running just a tad bit behind, but we're here now and we're ready to get going. We're starting out today with our behavioral health partners. So that's Artists Helping the Homeless, Bert Nash, TCCA, Heartland Community Health, Heartland RADAC, Lawrence Douglas County Public Health, and KSSPHQ. Checking attendance. Good. All right. And Bob Tryansky is online. Good morning, Bob. And I think Bob's going to give us the overview. Yeah.
Yeah. So good morning, everyone. And thanks for this opportunity to review the recommendations and priorities of the community or for the 2024 behavioral health projects budget portion of the county budget. As we've done in past years, I want to start off by presenting a very brief overview of how we've taken. We do this typically. We take the individual budget requests from each of our partner agencies and try to provide kind of just an overall synthesis of that that's aligned with the 3 focus areas of the behavioral health plank in the community health improvement plan. Everyone will remember that those 3 priorities are prioritizing prevention, promoting integration across the system of care, and improving access to care. This is essentially, for the most part, a series of budget recommendations that remain pretty flat from last year with a couple of exceptions. The one thing I want to point out is that there are several recommendations related to Bert Nash that include what we've talked about for a while as a targeted funding reallocation, where we've taken dollars that were formerly applied to offsetting the cost of health insurance at Bert Nash and applied them to projects and programs at Bert Nash that have a funding gap in an area that is a priority for Douglas County. So I will point that out as we go. And if you have questions for Patrick or Sarah or myself, please don't hesitate to interrupt for that or for any of the other pieces. I also want to remind everybody that when we're talking about the behavioral health projects portion of the budget, that the dollars for these recommended priorities come from 2 funding buckets. One bucket is property tax mill levy dollars that were established in 2017 to start funding some of the initiatives that came before Proposition 1 and some of the bigger projects such as the TRC mobile response and the Douglas County crisis line. So as I work my way through these, I'll identify what dollars are on sales tax, what dollars are on the mill levy. And like I said, we want to try to keep as much time as possible for questions. So I will move quickly, but please feel free to interrupt if you have questions along the way. So let's start with looking at the prevention priorities in the 2024 budget. Essentially, this area stays the same. We have $150,000 in sales tax dedicated to maintain support for Engage Douglas County, that prevention coalition that DECA has led for several years now. It will support activities such as the implementation of Good Behavior Game, the Sources of Strength pilots in our secondary schools, the Handle with Care partnership between law enforcement and the school districts. And if you'll remember, the $150,000 of county funding matches $125,000 in federal funds when DECA was successful in securing a drug-free communities grant the year after we started this work together. So maintaining that support at $150,000 on the sales tax is the first priority under prevention. Maintaining free access to MyStrength for all Douglas County residents at a cost of $28,500, also on the sales tax. Continuing to support tobacco cessation and anti-vaping initiatives are a priority for all of our partners, but that work is led by LDC Public Health and LiveWell. Let's talk about integration across the system of care. The first item is an example of one of those places where we're recommending targeting dollars that were formerly supporting health insurance at Bert Nash towards various projects and initiatives at Bert Nash. You have a summary of this in your packets, but I just will highlight each one as we go along. So the first is to provide operational support for the Assertive Community Treatment Team. The ACTS team, this is in its 2nd year of implementation. In its initial year, it was supported with some grant dollars that will go away in 2024. And so we're recommending the $200,000 from the sales tax goes toward targeted funding realignment to support the ACT team. Continue to support the data sharing collaborative. That's that work between the Behavioral Health Leadership Coalition, led by Douglas County Public Health and in cooperation with KU, Cochran Logan Center, to build a data repository for our work. Continued support for the Douglas County Crisis Line, that 24/7 air traffic control hub that deploys the mobile response team and is linked to 988, $326,000 again on the sales tax. In terms of funding for the TRC, we have a braided funding model that includes county dollars to provide operational support for the TRC after CCBHC revenues, private insurance revenues, and KDAD's Crisis Intervention Center grant funds are braided. So Douglas County becomes the fourth strand of the braid at a cost not to exceed $2.8 million on the sales tax. The mobile response team continued to provide $220,000 of sales tax funding to support the mobile response team and their deployment from 8 a.m. to 2 a.m. 7 days a week. This is another area where we're recommending a targeted fund realignment of $225,000 to support the mobile response team. So a total of $445,000 to support that project. Peer Fellows project continues to be supported at the same level since we came online with this project. There's $185,000 to support 6 to 12 Peer Fellow positions. When we say 6 to 12, some of these positions are half-time, some of them are full-time now, and so there's flexibility in the number of Peer Fellows we have in the program at any given time. There's additional $45,000 to support the development of a consumer-run organization to continue to experiment with the peer first response community outreach model that Heartland Radec is providing leadership for. And we want to continue to expand the Peer Fellows host sites to sites such as Just Food, Senior Resource Center, county libraries, continuing like we did in past years. Last year, we expanded to United Way and Family Promise. So we're always looking to build new partnerships with that project. There are a number of pieces of the supportive housing portion of this work. You'll remember last year that we engaged Corporation for Supportive Housing to do a comprehensive needs assessment for the permanent supportive housing needs of Douglas County. And we have a number of projects that have been ongoing since before that needs assessment came into place, but we now have a shared objective in the behavioral health plank of the plan and in the safe and affordable housing plank of the plan to increase the amount of supportive housing in Douglas County, both transitional and permanent, to move and make progress towards that overall goal of achieving functional zero for chronically homeless individuals in Douglas County. The specific projects recommended to be funded this year are to continue to provide operational support for transitions on the treatment and recovery campus, $180,000 in sales tax, along with a targeted realignment of $300,000 from the health insurance to support internal realignment at Burt Nash. Continue to support Artists Helping the Homeless, Kairos and Meraki projects that they serve up to 16 individuals at a time. Cost is $376,686 on the sales tax. Supporting clients in county-funded supportive housing projects with intensive care coordination and intensive case management services. That service is system spanning, no longer just serving clients in the emergency department, but serving our partners and agencies and the need throughout the community, as we discussed at the last study session. Considering additional capital support for the transitional supportive housing project at DECA's Lakeview campus. We've talked about this for a while. We think that 2024 is the year that DECA will launch this project at a cost for capital funds of $400,000 of support from the county on the sales tax. And then, as I said before, there is some capacity this year in the sales tax to consider one-time capital support allocations for supportive housing projects at Burt Nash and Artists Helping the Homeless. Those dollars are available because the TRC did not come online as quickly and as soon as we had hoped, and there has been the accumulation of some of the sales tax revenues while we have implemented these projects, in a slightly slower timeline than originally anticipated. The RAP program at Burt Nash experienced budget reductions in 2023 from USD 497 in the city of Lawrence. So we're proposing a total allocation now of $860,000 to Burt Nash for the RAP program. $390,000 of that is the mill levy portion that was dedicated to the RAP positions and county support for the RAP program prior to Proposition 1. Proposition 1 extended the RAP program to Baldwin, Eudora, and Lecompton, and the cost of that was $260,000 on the sales tax. We're recommending that $210,000 in that targeted fund realignment go toward the RAP program to offset the budget reductions from USD 497 in the city. I want to continue to support DECA in their efforts to improve services to assist families in overcoming immediate crises. Last year, the allocation for that was $104,000. This year, we're proposing to support DECA's efforts up to $50,000 on the sales tax, and then we took the additional $54,000 and reallocated that towards SUD treatment. I'll talk about that in a moment. And continuing to support the work of Lawrence Douglas County Public Health and KSPHQ in leading the implementation of the Zero Suicide Initiative. One of the things that makes our work here in Douglas County interesting for the Zero Suicide is typically Zero Suicide is something that's done by an individual agency. The fact that we're trying to integrate this model into all of our community partners is fairly unique in the state of Kansas and nationally. In terms of improving access to care, we want to maintain the funding for 6 care coordinators and half-time supervisor for the Heartland RADAC Care Coordination Team. I'm just looking at this and realizing that I have a typo. We're not proposing $662 million for this effort. It will be $662,700 on the mill levy. Psychiatric infrastructure we should talk about. We're recommending that the psychiatry supplemental remain flat at $400,000, but that those $400,000 be split between Burt Nash and Heartland Health. As we know, Burt Nash has experienced the loss of one provider and the reassignment or the repositioning of another provider from outpatient services at Burt Nash over to the medical director position at the TRC. So the cost of that position becomes absorbed into the TRC's operating budget, but that leaves one and a half FTE that was in place last year. Burt Nash is looking to replace those providers. At the same time, Heartland has had the opportunity to hire a child psychiatrist. And so what we're proposing is that the $400,000 be split. $121,500 goes to Heartland Community Health Center, and then up to $287,500 would go to Burt Nash to replace and support those providers. In both cases, funding would be contingent on staffing the new providers and maintaining those providers. And then there's an additional recommendation to offset the existing funding gap for med services at Burt Nash, $300,000 targeted towards offsetting that gap internally with the existing dollars that were originally used for health insurance. In terms of substance use disorder programs, we want to reassess needs and refocus strategies to address SUD-related objectives in the community health plan. I'm hoping that we might be able to conduct a comprehensive needs assessment in this area in the coming months. But in terms of prioritizing offsetting the cost of treatment and ensuring from an equity perspective that people are able to access the treatment that they need in the SUD space, we want to continue to provide supplemental funds to reduce disparities and support SUD treatment for men and uninsured women. This is a place where we have taken $54,000 of that line that was allocated to youth crisis services, as that part of the equation has not sort of realized that cost yet. So we pivoted $54,000 to add to this line so that it was not targeted only for men, but could support uninsured men and women. That's $236,000 on the mill levy. Continuing to work with community partners to expand smart recovery. Prior to COVID, we had 6 meetings in Douglas County a week. with a whole sort of cohort of facilitators that have been trained. We're going to try to build that up again in 2024. And so there's a small allocation of $15,000 on the mill levy to do that. And then this is again, the major new expense, even though it's an extension of an expense that was built into the budget in previous years, and then it kind of extended through 2023, again, because the delays in bringing the treatment and recovery center online. So continuing to support expanded community access to social detox services beyond the emergency crisis settings of the TRC and the LMH emergency department. Talked about this now for several months, and in order to extend that through 2024, the estimated cost from DECA is $309,810 on the sales tax. So that is the list of priorities. And again, the two new spending areas are that community-based social detox access, and then to the degree that the commission would like to consider supporting some of the supportive housing projects that have been proposed by Artists Helping the Homeless and Bert Nash, there is capacity for one-time capital support in this budget. So with that, I will stop talking and turn for questions.
Thank you, Bob. Appreciate that. Commissioners, do you have an area or a partner you'd like to start with, or do we want to just go alphabetically? Almost all of these have supplemental requests involved, so.
We have a note.
Okay,
And
it's not 662 million.
no, it's not 662 million. Sorry, Jason. The supplemental request for Heartland for psychiatric that amount is included in the $400,000 that is set aside for psych infrastructure. And I'm going to wait for Bob to nod his head. And so in essence, that is built in. We showed it because of the timing of everything, and that way we're transparent on that request. It is not marked as included on your option sheet, but I wanted to clarify that there is room for that inside the $400,000 set aside for psych infrastructure.
Great. Commissioner, alphabetical.
I do have a note in our schedule that says DECA needs to go first. I don't know if that is still. Okay.
We have a statewide meeting that's starting.
Well, let's start with that guy.
Well, I'll kick that off since I suggested it. So we have a supplemental request for a school-based programming prevention specialist. Tell me how that interacts with RAPS, how it's different, how it's the same.
I have Chrissy Meyer, Mayor, answer that question because she is our prevention expert.
Sure. So the school-based component would really focus more on SUD services. So we'd offer like screening, brief intervention, and referral to treatment for our young people. That's really a gap in our community. We talk a lot about crisis, but if we can catch them early, then perhaps a brief intervention can intervene and support that. Right now, as we've spoken with RAP workers, they don't have capacity to do SBIRT-specific screenings because they're dealing with kids in crisis. Long-term big picture goal, there are states who do universal SBIRT screening in 9th grade. That's what we would propose here is for all freshmen to get a brief screening and potential referral treatment for that.
Which school districts would you be working within?
We would just determine kind of who is interested in that piece. There are components originally with our original proposal, we talked about offering Baldwin, Eudora, and Lecompton initially, and then doing an early childhood specific piece in Lawrence Public Schools. We've also submitted requests to the Kansas Fights Addiction Act Fund for school-based prevention initiatives. We won't know about that until October as well, and that would offer additional prevention specialists to be able to do that in the districts.
How would you approach like Santa Fe Trail and Shawnee Heights school districts that have students within Douglas County, but they are majority outside of the county?
Sure. So typically, as we've been working with the county, it's been those 4 primary districts. So we haven't addressed Santa Fe Trail or Shawnee Heights. That's something we could certainly be open to exploring if there is interest and need.
And can you just say real quickly before I look it up, how many FTEs is included in that 307,000?
I believe there are 2.5. I'll double check that. Yep, 2.5. Basically, it would be two, well, no, I lied, 4 full-time prevention specialists. Then there would be 35% kind of oversight and support from 2 other staff. So it'd be 4.
Okay. I have a couple other questions for Decca, but does anybody else want to add on to that one?
I wanted to just ask, so have you had conversations with any of the school districts yet to gauge
There's been
interest?
there's been some initial questions about, hey, what could we do? How do we do this differently? And a lot of that evolved from our youth empowerment and prevention programs. A lot of the sponsors are social workers, other school counselors, and they've expressed a lot of interest in, it would be great if we had X. Especially in Eudora, there's been a specific interest from their counselor related to just the kids that she is seeing. And she's like, it would be great if we could catch them earlier and do some different pieces. And it's a capacity issue in the schools. Schools just don't have the staff to do this kind of work when they're dealing with other issues and kids in crisis.
We also are seeing more and more schools have issues with suspensions and or other issues with school that are substance abuse related. If we could get in and work with schools, both for those who are showing signs and symptoms, but those who are also at risk, at higher risk, if we could intervene sooner, that makes a huge difference.
So, and we've had some conversations about this. Currently, we can do screenings in schools. Is that correct? I mean, if we have a student who, a parent, once we have parent contact, authorizes the screening, does our Douglas County funding cover that screening?
The screening would be a brief intervention in
Right.
the school. If we need, that would determine whether there needs to be an assessment
Okay.
for treatment. And yes, the assessment could be part of the Douglas County uninsured. We would do the same thing we always do. If they have insurance, we're going to bill insurance.
Yeah.
If they're eligible for other funding, but then that would definitely be a source we could use.
But that's already in place, right? Okay.
Is there any conversation, going to ask the same thing about RAPS later, any conversation with having some kind of a youth feedback, youth advisors or somebody where you're getting feedback from the students that are also being served?
Sure, absolutely. That's something we've written in and talked about having some specific peer mentor programs, and especially with our Sources of Strength program, implementing more school-based projects could enhance that as well. And the Sources of Strength piece is really a peer-to-peer piece, because when kids are struggling, they're not going to their teacher first. They're not going to their mom and dad first. They're going to their friends. So how do we best equip kids and identify, here are the things they need, and here's how we can best support them. So yes, absolutely.
Yeah, any way we can empower those,
Absolutely.
empower who we're serving, but especially youth that have, a different voice and need to be heard with what services they're looking for is great. And the other piece of this would be, are there discussions in how this would kind of interplay with our truancy partners also to kind of, so between this position and RAPS and truancy to kind of look at some overarching systems?
Sure. I think that's something we definitely need to consider and work on. We have not done any, specific outreach, related to truancy, but there would definitely be overlap and opportunity for coordination for sure.
Another item is the Behavioral Health Summit. Can you talk about that? So is it a supplemental request?
Sure. So we offered a behavioral health summit in 2020 and 2021, or maybe it was 2019 and 2020, 19 and 20.
Yeah.
The 2019 summit was an in-person event, very popular, lots of good feedback. We offered CE for professionals. We had a lot of community partners and also just general parents, folks like that attend. We brought in speakers from Colorado to talk about, marijuana legalization and what that looks like, and just really kind of informing the community about, here are some current issues, here's what this looks like. In 2020, we obviously pivoted that to a virtual summit. It was pretty successful as well. We had great attendance, and then also attendance from others outside of the county. Folks outside the county were charged a fee to attend, so we were able to offset some costs that way. But it's just an opportunity to bring high-level speakers and engagement to Douglas County.
So the 25,000 is not the entire cost of that summit. You're recouping some of those costs from,
If we
Paid
have
entry.
folks outside of Douglas County, yes, we would charge a registration fee for those.
and how have you paid for it in the past?
Originally our allocation from the county was $170,000 in 2019 and 2020. And so when we received the reduction, we cut out the summit.
Thank you.
Mhm.
Did you co-host those summits with anybody else, or was it, you're talking about out of county folks paid? But you, DECA as an organization serves a region and multi-counties, so help me understand if,
We only provided that for Douglas County and partnered with the Behavioral Health Leadership Coalition agencies and people they served and partnered with.
okay. got
So
it.
we did not, that was a Douglas County summit. It's just, right, people here and come in from other counties. So we charged those that came in from other counties. It was not billed as a multi-county event. Is that your?
That helps. I guess it's a two-part question. One, to just know like who locally you're collaborating with to, or who you have collaborated with to create that summit, and whether or not your organization has had a conversation about whether there's value in it being a multi-county regional. Maybe other counties
Already
nearby
hosted.
have some.
We already host a statewide
Okay, got
event,
it.
an opioid and stimulant summit. So we already host that.
Got it.
For
Thank you.
other parts of the state.
Kind of last question. Thank you for the balanced budget. I love that. Your unrestricted net fund balance is shown as a negative, and I'm just asking for clarification on that.
It's been a minute
Question.
since we
Mhm.
submitted. this.
The
Are you
top,
talking?
top right-hand corner. It's shown in parentheses as,
We have, are you wondering, did we actually end in a negative? Is that what
well, I'm
you're-
assuming you did not. I'm just curious, like why it's shown that way.
Because that's our actual, we have funds that allowed us to cover that. That's in our, if you look in our entire financial statement. Yes,
So you
the
transferred
transferred
funds
funds,
from
yes.
another part of DECA's operation to cover
Cover,
that negative
yep.
amount.
Okay.
And again, without, I don't know how they'd show that without showing it as sort of a one-time weird revenue.
Right.
Got it. Thank you.
And so just something to think about, we talked about with our partners yesterday, and DECA is sort of unique in that it's a regional approach. That when we're thinking about fund balance, we'd like to think it across the organization. This is obviously specific to Douglas County. So I don't know if there's a way to make an adjustment in your budget sheet that sort of shows the entire.
I think it's just something that's come up that the commission would like to have a sense of for organizations that just show us your one part of it, that we also have some sort of sense of your overall financial picture and financial stability. But we can talk about that for future years. Does that make sense? Just to,
We can do whatever you ask.
okay, thanks, Laurie.
Sometimes we think simple is better when you look at our budget.
Totally
We're happy to
understand.
share the whole thing. if you
Everybody does
really
it
want.
different.
I think we also want to make sure that we're asking the same thing of each partner and not treating anyone different than another. Any other questions for DECA?
I didn't ask about the social detox because we'd heard from that pretty recently, so I understand why that supplemental request is there.
Okay, let's move on to artists helping the homeless.
I was just gonna suggest that. Thanks y'all for coming.
Thank you for coming. Yeah.
Before DECA leaves too much, I had kind of a blanket statement I wanted to say to partners that kind of summarize some of the things that I had asked individual partners yesterday. And that's because I know you'll have capital projects coming up that are not yet here. But for any capital projects that come to the county, I would very much like to see the full list of funding sources, either pending or proposed or secured for capital projects in the future. And so some of those, I'm going to ask for those to come back for Monday. Yours isn't one of them. I just want to make sure that you were here to hear that too. And also, if we don't get a balanced budget for an organization, I'd like to have just a 1 or 2 sentence about why. Many of those did, some of them didn't. So I'm just putting that out before you take off, but thank you.
Is there a timeline on the funding, on the capital projects?
So your capital project was in, right, so. yeah. No, that's fine.
Okay, sorry if I jumped the gun. Carwoo's sitting in there. Maybe I'll start off with a question for artists helping the homeless. One of your requests is for one-time money for essentially paying off the debt on both houses, and yet in your budget, there's a list for debt payments. Would that debt payment that line go away if we paid off those houses?
Yes.
So that would mean there would be another $30,000 available
For operating expenses.
for operating expenses, and then you have an operating request of 26,000. So that would cover that.
That would help reduce the total operating costs.
Well, I just want to make sure I'm clear. If we fund the one-time request for both houses, right, that would take your debt cost away. So that would give you $30,000 in funds, right, that you could then apply to your additional staffing or the additional funding that you're requesting.
Yes.
I have a couple of requests about the current loans that are being asked to be paid off. And so one of those, they must be both be have balloon payments, one in September of 26 and the other for September of 27. So I was curious about the rates on those loans because we're being asked to pay them off. But if it's especially cheap money that was secured a few years ago, there might be a better way to help the organization than paying off cheap debt, if that's the case. So I'd like to know what those interest rates are, if that's something that you could get to me. I don't imagine you have it on hand.
One of them is 4.5% right now, and the other one, I believe, is 5.5. That's anybody's guess. It's prime, yeah. So.
Okay, thank you for having those in your head. This is one of those where we may be asked for a capital request, both for paying off the houses and also an additional home, where I'd really like to see where else are you asking for funds? I think it's entirely appropriate to ask for the county for some capital funds for that. I'd like to see what that full picture is, because I know there are a lot of granting organizations that really like to give one-time funds to capital projects. And I think this would be a great fit for many of them. So I want to see that there's some other opportunities that are being looked at. So I know what percentage of the funding is being asked for from the county versus other places, and including outside of the community.
My understanding is these projects are proposed for 100% Douglas County funding.
Correct.
And
for the capital.
I'm not sure that they would need to be. I think there are a lot of other options out there.
That is up to the commission to tell them. I'm just telling you what they
Okay.
proposed to us. Is
All
They're
right.
not asking anyone else.
All righty, thank you. And then I had a question about the budget overall. It's a negative budget with $107,000 decrease. So which puts you in a negative fund balance. So can you talk about, is that without the county inputs that you're expecting? And then that would bring it back to what position?
Well, the budget this year does go into a negative. And part of that draws down a prior surplus that we had when we started up. And then part of it draws money in from Artists Helping the Homeless, the bigger organization. So we keep the Douglas County money separate. And so this is just the Douglas County portion.
So this doesn't include any inputs that would come from the rest of the organization as a whole.
That's correct. If we get money from Douglas County or people in Douglas County, it goes into that.
I guess this is another one where I'd kind of like to see the organizational budget so that we can evaluate the health, because if this is the only picture, then it's pretty dire. And also for us to know, like, when we're serving Douglas County residents, are those Douglas County funds serving them, or are they outside funds? I don't necessarily want to see us drawing from the work in Kansas City to support the work here, but I'd want to know.
Mhm.
So I think we could use a little bit more detail if that's okay to get it to us.
Sure.
I guess I'd need to know at least how much and what that's going to do to the program budget for Douglas County.
Yeah, I've got it at home.
So I'm going to move on to the $900,000 request for a women's house. And in your statement, it says that we don't have support for women in recovery. And my understanding is that that's what we do at DECA. Have you had conversations with how your services that you're proposing here may overlap with DECA? I'm not saying there isn't the need in the community. I'm just wanting to make sure that we understand.
We don't have a direct conversation. Yes, my understanding is the community is needing more support for female because the disproportionate female percentage of homelessness and as well as in recovery. So we are trying to like create a program to replicate what we do to provide true full wraparound services so that to support the need for the county.
How many women would that support?
So I would say 8 at a time at least. So because like in a year we work with maybe 60 people, but like as they come and go, like I think the maximum capacity for each house is around 8.
Thank you.
Commissioners, I was just going to add also, when we think about who this program would be serving, it will mirror our current program partnership with Sheriff's Reentry. So the Sheriff's Office currently identifies folks that are being released from the facility that meet the criteria. They get screened by Artists Helping the Homeless, and then if they're approved, they transition. This is primarily aimed to be a resource for Sheriff's Reentry. And then when there's capacity, like we do today, we invite our community partners to utilize that resource when there's capacity.
Thanks for that, Jill. I was just going to ask Karu, can you explain what Artists Helping the Homeless definition of recovery is? Like, is it specific to substance use? Is it broader than that? Can you talk to us about that
Yeah, it's
language?
a little bit broader than that. We focus on recovery and reentry both. Our goal is when we set total wraparound service, we really mean it. So we provide everything for them from transportation to food to housings, but we do not rush them. We let them we ask them to slow down to kind of identify what their needs, what their wants are, and we support that. And from my Asian background, I actually encourage people to go to college or vocational training. And because I think those are better for long-term success. If they can find their calling, what they love, then they stay more focused and do the things that they love, and then they will become a contributing member of society. So that patient part, I think is really important for us to really give them that opportunity to really set their mind to change. I think I shared with Commissioner Karen, is like in the last 5 years now, over last 2.5 years, we have more than 5 of our graduates clients have purchased homes coming from homelessness to home buyer, and the home they purchased $250,000. On our second phase housing, 80% of the people we serve bought their own car. And that's really important for becoming independent. If you don't have your own transportation over time, you don't move forward in life. So for that percentage, I think it's also very important. So we really tried our best to build the self-independence as well as the self-confidence so that they become a contributing member of society in the long run. So I think last year, our people that we serve actually paid back the county more than $10,000 in fine, and which I don't think you hear that a lot for them to contribute back to the community. So our goal is really give them every opportunity to excel. We want them to excel. We don't want them to survive. I think that's the thriving part is the most important to us. I hope I answered the question.
Yeah, thanks, Karu. I just wanted to you helped illustrate a distinction between, well, first I want to say, I do think it's important to purposefully have some more direct conversations with community partners. I know some of them you work with really regularly. DECA is one that I would imagine you have a lot of overlap with. And sometimes folks might go to First Step first and get some inpatient treatment, and then Artists Helping the Homeless might be a good step up and transition for them. So I just want to encourage that those conversations happen as you are developing this program and trying to fill a gap for female residents in the community. And it sounds like the goal is to sort of parrot what you're doing with the Men's House in terms of primarily focusing on reentry referrals, correct?
Yeah.
Okay.
Yeah.
My question is, do you have, so you're asking for capital costs, and I'm not asking you to reveal a whole bunch of details, but can you talk to us about how far you are in terms of identifying potential property, what the actual cost of that will be? Like, how tangible is the idea and the plan right now? And how did you come up with the 900,000 for those capital costs? Is it because you have some properties in mind, or that's just a range that research has told you?
I think it's because I've been looking around the county, trying to find the right property to use, and the average price on the appropriate property is around 400,000 range-ish. And for us to be able to really house them and give them a very nice, safe environment. So I think that's a number. That's why it come in. I've been looking in the last 3-4 months to see what is appropriate. Hopefully the price of houses will come down a little bit. Yeah. So.
Okay, should we move to Bert Nash? Thank you, Carwo. Thank you.
Thank you.
I'll kick it off while we're still flipping pages. The question for Stephen. You mentioned in your narrative of wanting to get to a 3-month buffer for your fund balance. What is that target number that you're headed towards?
Yeah, so it's a bit of a moving target. So one of the, I guess, good things is we've grown significantly over the last 5 years. The challenge is it significantly increases what we need to have a fund reserve. So if you figure in 2024, we're going to have a $37 million budget. We would want 25% of that, or $10 million in reserve.
Thank you.
Yeah.
I guess I'll follow up. What's the timeline to possibly get to that point?
I think for me, that's a challenging question as we balance trying to take care of our employees and the community. So every year we balance how much care to give away, how much to invest in our staff, and how much to save. The last couple years, it's been challenging to save because the need for our services is so significant.
Thank you.
My question isn't around budget so much as it is around governance. And, can you describe your board and how your board is made up? And how decision-making is made on that board based on its makeup? Sure. Our board is a 12-member board. 5 of them are appointed or selected by 2 bodies. 2 are chosen by Douglas County. 2 are chosen by the city of Lawrence, and they share the appointment of 1 individual that they decide. And then the rest of the board is made up of community members. Our board does, of course, have a standard structure in terms of a board chair, chair-elect, treasurer, secretary. And so depending on the decisions that need to be made, many of them, of course, are business operational. Those are vested in myself and the leadership team. But there are certain decisions that obviously have to be made by the board of directors, or at least informed by them. And so it really just kind of depends on the issue. Things like simple policies and stuff, we don't bother them with that unless it was going to be a huge global policy, such as when we changed health insurance and took that on ourselves. We obviously wanted them to be aware of that and involved in that, because that was a significant investment on our part by taking that on directly at Burt Nash. If we're going to move into a large new project, the board is going to be involved and inform and help us make that decision with the ability to say, no, we don't want you to do that. We want to go in a different direction. So it really is dependent on the item and the issue.
So based on your budget calculations, 19% of your organization's budget comes from Douglas County and 1% comes from the city. Does it seem to be the right mix to have equal representation from the city and the county based on those budget numbers?
That was established decades ago through your interlocal agreement. And so I'm not sure I'm in a position to say what the proper mix is. If you think about it, they're all Douglas County residents and reside within this community. And so there is representation across all of Douglas County on our board.
I'll move to something else, if that's all right. So I mentioned also with the RAPS program, just like the SUD potential program, is there a way to have student feedback within that program as it's developed and changes?
Yeah, so every year, twice a year now, we survey all of our program participants, which includes the RAP program. And with RAP, we're surveying the parents and the youth and the school districts. So we're getting feedback from a variety of sources. Also, related to CCBHC and CARF, we are developing various sort of advisory boards and councils, and we will have a youth advisory board to help inform our services.
What's the time frame for the youth advisory board?
I would hope that we would get that done in 2024. We've got some big mountains to move yet in 23.
Talk to me about the 136,000 supplemental requests for RAP.
Yeah, so that is just the result of the cost of the service increasing. So we were able to offset quite a bit of that through CCBHC, but our personnel costs have risen significantly, double digits. The therapists salaries, and it's long overdue, but they are increasing significantly. And to retain talent here is just more and more expensive, especially in an environment where many of our providers can work here for companies all across the country with telehealth services and not even have to leave their home.
And so RAP serves in 4 of the school districts within Douglas County, is that right?
We are in Lawrence, Perry, Lecompton, Eudora, Baldwin, and Bishop Seabury Academy.
Is there any mechanism when Douglas County students that go to a different school district, like in the southwest part of the county where there are 2 other school districts represented, that they could have access to RAP services?
So, they're eligible for Bert Nash services as Douglas County residents. We don't have RAP in those school districts, and we're already don't have enough RAP capacity to serve the kids in the building we're in. So I think the reality is for those outlying school districts, we can serve those kids at Bert Nash. We have a commitment to serve them, but during the school day, I would hope that those school districts are also figuring out how to meet the needs of those kids as well.
I don't know that anyone's had conversations with some of those school districts to date.
We haven't, and when we did the 2018 ballot initiative, it's just also really complicated because the majority of the kids in those districts are not there. So then you have somebody in the building and saying, let me see your address before I talk to you. And I'd be nervous about then using Douglas County resources to benefit Shawnee and Osage County. So, I
Totally agree with that, but
I
there
think
may
it's
be some other
something-
mechanism.
they can certainly go to Bert Nash. That is the mechanism right now, but I think it's something that we can look into. Is there a way to have information available in those buildings for their counselors to refer Douglas County kids to resources in their communities? I think it's something we could try to follow up on.
So I just want to put a point on RAP services is that funding for RAP services was funded through the city and was considered no longer part of their strategic plan and was funded through the school district, right? And now Douglas County is being asked to raise its burden to pay for those services. Is that correct?
That is correct, although in fairness, Perry, Lecompton, Baldwin, and Eudora all contribute to some degree to supporting the RAP program. And then Bert Nash also has had to take on significant additional I won't use the word burden, these are kids, opportunity to try to make this work. And we've integrated it into the CCBHC model, but that has fundamentally changed the program to some extent. But no question, the reduction in funding, the county is feeling that in our request.
So is it fair to say that initially when those cuts happened, you thought the CCBHC model would help cover that difference and it hasn't made up for that as much as you expected?
When the funds were first cut, we had no idea what we would do. The opportunity to become a CCBHC came after that, and we tossed a Hail Mary out there. The important thing to remember about CCBHC is it only ever covers a portion of the cost. So it's never the only answer. And sometimes If you add something with CCBHC, you actually can make your financial problem worse if you don't have a solution for the difference between what it pays for and what it doesn't. And then RAP is a program with a very diverse payer profile, meaning that a lot of the kids we serve, their families, they don't have Medicaid, they have commercial insurance, and that burden does not fall on the state Medicaid program.
Stephen, so the city of Lawrence cut their funding historically have, since you made a point of pointing out that other school districts and other cities in the county contribute, have you ever talked to any of the municipalities? I mean, I'm interested in knowing about conversations with school districts, although I understand generally what they, the school districts don't have that funding, but just want to know if there's been any conversations with municipalities. And then the third question there is, you mentioned Bishop Seabury, which is a private school. So talk to me about how does Bishop Seabury provide any?
Yes,
payment?
Bishop Seabury does cover the cost or the majority of their cost. Yeah, so that's something we've worked on with them for a number of years. Sarah, do you have something on the other part?
I just want to clarify, none of the cities contribute to
N-
RAP.
No
Only
city.
districts. So
Only
those
the school
other
districts.
Contribute. Perry, Lecompton, Baldwin, Eudora contribute, not the city municipality itself.
So the school districts do contribute something. The municipality of City of Lawrence used to contribute, but has stopped. Baldwin, Eudora, Lecompton have never contributed, their municipality governments, I mean. Okay, just wanted clarity on that. And this is a question for, I guess, Bob and Sarah, just to make sure I'm understanding math, right? So we have already sort of increased our share of RAP that's worked into the budget, right? We already had the mill levy and sales tax allocations, and now we are realigning 210,000 and change from the insurance, the health insurance kind of budget, right?
Yes, correct. Before, in 2023, $650,000 was contributed by Douglas County to RAP. And then now $210,041 of the health insurance funds will also now go to RAP. That will still leave a delta or a deficit of around 230 in RAP.
But we added,
210.
okay, thank you.
This, and then their
And then they're
supplemental
asking
request
for,
would be on top of that 210 is
Thank
my
you.
understanding.
thanks, Sarah.
I know we're getting close to that time. Is it okay to move to a different organization?
Everybody's ready.
Your responses.
So Jason's been sitting next to me and can probably see my notes and might anticipate this question already. So you have a supplemental request in for a cost of living increase, but you've also got, you're adding to your fund balance this year with the surplus budget. So to a larger
The
degree. than the
supplemental
cost of
increase
living.
isn't to increase our surplus fund budget. It should be on.
Okay.
Sorry, I had turned my head, so this is
Sure.
one of those things. So your question is about the supplemental increase as it compares to what?
Well, we don't normally entertain a lot of requests for just cost of living
Absolutely.
increase.
Yeah.
And so I'm curious about the timing of asking for that, which is a little unusual for the county, while also having a surplus.
Sure.
budget.
Yeah, and we're simply asking for that because the cost of doing business. Stephen actually talked about it very eloquently when it comes to the cost of people and the cost of providing the service. And right now we're asking all of our funders for increases in their budgets to offset those additional costs right now. And so this just matches what we're using other grant funds to come in and assist us with the people that we have on board. And between that and the supplemental money we're providing so that we can employ 4 full-time peers here, it's just becoming a bit of a challenge financially to maintain that, even though we do have a fund balance that we can draw down. this is not what you want to use your reserve funds to draw down on. And so we try to keep that fund balance at about a 6-month rate.
Commissioner Willie, maybe it's the same question, but here's my question when I do the math, Jason. I'm looking at your revenues at being 9.4 million. And I'm looking at your expenditures at being 9.2 million, right? So your expenditures are below your revenue. And yet we have a supplemental request for 100,000. And I'm just trying to make sense of why you would ask us for a supplemental request when you're not spending all of the dollars that you have in revenue.
Well, and we certainly can do that. And that's what we'll end up having to do, which is why we're asking for the dollars. If our expenditures are that much below our revenues, then that additional money can go into reserves. And that's our goal every year, to be able to put some unrestricted dollars into reserves. It's an ask. I went to KDADS and I asked for the same amount. Generally, we're asking for a 30% increase because over the past 7 to 8 years, we've seen such a significant increase in personnel costs. I think this request is a 16% increase, something like that. So I'm asking KDADS, I'm asking KDHE and DCF and DOC and both Medicaids and all of that. And some of them are saying, that sounds like a good idea. And some of them are saying, no, go suck an egg. And that's okay too. So we'll figure it out. It's just one of those pieces that we're certainly going to continue to ask. And if it works out, great. If not, we just have to think about where we're providing our resources.
Didn't mean to jump in, Commissioner Willie. I didn't know if that's where you were headed.
No, it's a
Was
valid question.
exactly what I was
Okay.
aiming at. So thank you. Because your fund balance is pretty close to that 6-month.
Yeah.
And many of our partners are not yet. So.
Yeah, we've been very fortunate financially to be able to do that for ourselves. So.
Well, and I'll just note, we didn't do the same thing with Bert Nash, but Bert Nash's expenses are below their revenue. And so that's also something that if Bert Nash wants to respond to that, since we've had it here with Heartland Rate Act.
I did ask him while you were flipping pages. That was my first
Oh,
question.
thank you. Never mind. Should we go on to Lawrence Douglas County Public Health? Okay. Sonia, and I'm actually okay if you don't know the answer to this question.
Okay.
But I was surprised to see the city of Lawrence in your budget, because I think we've heard rumblings that that may not be included. I know that the city manager is releasing their budget.
Yeah.
We were a little surprised by something we heard on Monday. And so I've wondered if you've had any similar discussions.
We have not. And we looked through the budget that was released, and it's a little cryptic to try to find us in it, and it usually is. So that's kind of par for the course. So at this point in time, we don't know. And we're hopeful that we would have more notice than for something to be released now, but we can't guarantee that. And we just don't know. So.
I've asked the city manager to let me know if he was going to make any changes, and he said, I have not. So I'm not anticipating any changes for the 2024 budget for public health.
That's the only question I had for Lawrence Douglas County Public Health. Okay. KSSPHQ, any questions for them?
I will just correct it. It's just KSPHQ. There was just a
Yeah.
typo on here. So unless we're adding another.
I was
S I'm not aware
questioning
of.
myself, but I was reading what I was given.
Yep,
so-
all right.
Can't help but abbreviate the whole state. Some of us just
Yeah.
have
Yeah.
to KS.
KS.
Answers no
Yes.
matter what.
Okay, if we don't have any questions for them,
Thank you.
okay. We will move on to our next group. Thank you all very much for coming.
We can have our targeted population partners come forward. Squeeze in, it'll be tight. Okay.
All right, are we ready to jump in here? Go ahead, Jill.
Okay. Good morning, commissioners. We have the category of targeted populations to cover in this next section. So you'll hear from, we have guests from CASA, the Child Advocacy Center of Douglas County, Cottonwood, Independence Inc., JAAA, Senior Resource Center, O'Connell Children's Shelter, Visiting Nurses Association, the STA Care Center, Trinity In-Home Care, Willow Domestic Violence, and the Center for Supportive Communities. This portion of the community partners budget so if we look at in total, the amount of spending on what we're looking, you're looking at this morning, including behavioral health partners and what we'll hear after this section, it's $13.08 million. The targeted populations that we're going to speak to today accounts for 2.5 million or 19% of that. You've got supplemental requests from Cottonwood, Center for Supportive Communities, CASA, STA Care Center, Willow, and I believe that's it, and Senior Resource Center. Just to hit the highlights of each of those real quickly. Cottonwood, you're seeing a one-time supplemental request for just to improve efficiencies and productivity in the space and meet some and have some compliance issues with Centers for Medicaid Services, Medicare Services, and some requirements related to some final rulings that they're anticipating, and just some other overall life enriching opportunities for some of the folks that they serve each day, and some capital improvements to their facilities. All those are listed in with some additional information in your packets. In terms of the Centers for Supportive Communities, their supplemental request is for $150,000. And that's reflective of a request that they applied for in previous years and trying to get closer to what they need to operate fully staffed. Again, additional information about that request is in your book. You then see a $20,000 supplemental request from CASA. And this is similarly to try to be able to serve more folks and increase the operational capacity to be able to serve more children and families in the work that they do. Senior Resource Center, you're seeing a $25,000 supplemental request, and that's to increase the wages for some of their lowest paid hourly staff, specifically for the Senior Wheels program that serves a lot of folks in our community each day all throughout the county. And I just see Megan Poindexter's joining us virtually as well. And then from the STA Care Center, you're seeing a $5,000 request to largely that's reflective of the loss of VOCA funding that they rely on to provide the services that they provide. Similar theme you see with one of the two supplemental requests from Willow Domestic Violence, a $50,000 supplemental request that's reflective of loss of state and federal grants, and then a supplemental request that is related to a partnership with the Sheriff's Office, the District Attorney's Office, and Lawrence Police Department and Willow to implement a blueprint for safety community. It's a really exciting initiative with these partners, and that additional funding helps them be an effective partner in that work. That's all I have to do this overview, and I'll hand it off back to you, Commissioner Kelly, for questions.
Thanks. So in advance, partners, thank you for being here. We probably won't be able to ask a question of each one of you. So if we leave you out, we're sorry. We have a limited amount of time. Commissioners, do you have something you want to start with in particular that you want to dig into?
Well, I'll start at the top. That's right.
Okay.
For Center for Supportive Communities, with that additional, the supplemental request, my first notes had 100,000, I guess it's 150,000 for three FTEs and one part-time position. Are those all within USD 497?
It could be an error on my part. I was looking at the supplemental last night. I was looking at a couple different things. So that could be an error on my part. Sorry.
Yes, so it's a little confusing because we increased it, the 50,000 this year, which I didn't put in when we submitted the budget. So it's really a $100,000 increase, but all of those positions would be working throughout Douglas County, not just USD 497.
How did you know? That's what I wanted to hear. And that is a portion of those 3 FTEs or 3 and 3.5 FTEs. Where's the rest of the funding come from?
So we have grant funding. We got an AmeriCorps grant, which was super exciting. So we have that, which will take effect in middle of August, beginning of September. So that will be super helpful. We're continuing to apply for grants consistently. So hopefully we'll be able to secure more grant funding, and then also donations and fundraising.
And are you able to have conversations between like the RAPS coordinators that are in the schools and the potential for putting substance use support within the schools? Are those things that kind of all tie in together?
Absolutely. Yes, they absolutely tie together. I think there's definitely room for more collaboration than what's happening right now. And I am definitely happy to have those conversations and make sure that we are partnering to get those services to kids.
I want to add that, so part of the work that we've done with truancy over the last year is really to kind of beef up our ongoing communication between providers and service providers. So I think that's something that we'll see moving forward. The DECA proposal is brand new, so it really hasn't been discussed because I don't think they wanted to roll it out in case it didn't get funded. But I think it's something we can do moving forward.
And Kelsey, I just want to make sure I'm clear on the numbers here because it got a little fuzzy in there. So the total ask is for, we did 150 finally, but probably not when this was there, right?
Correct.
And then you're asking for another 100,000 on top of that. So you're asking for funding at $250,000. And my reading of the packet was that you served 80 kids. Is that correct?
Not this year. So
Okay.
when we switched from being a practicum at KU to having more of a volunteer model, the number of weekly hours that they dedicated each week, although we had more mentors, we had 16, which was awesome, but not all of them could serve 4 to 5 kids, which is what we were used to. So we served about 40 kids in the 2022-23 school year. And hopefully with this AmeriCorps grant, we'll be able to offer more incentives for mentors, and we'll be able to give them the education award at the end of their service plus a stipend. So hopefully that will increase their motivation and take more kids and spend more hours.
So if we serve 40 kids with 150,000, that's $375 a kid. Right? I mean, I'm just trying to figure out how much we're spending per kid
Yeah.
on these dollars, because just that's not a huge number of kids we're serving for a significant investment. I'm not saying that the services aren't expensive. I can see that, but I'm just interested in, as we sort of start to figure that out, where, you know, where that threshold is.
So I think that it's a little difficult to break it down per kid because every kid spends a different amount of time in our program depending on their needs. So we could work with one kid for an entire year. We could work with another kid for 7 weeks. So it really depends on the number of resources that we're putting into each kid is going to be different. I will say that it doesn't, just because we served 40 kids, there were times that we had openings, but we didn't have the referrals. So I think that when we changed from KU to CSC, I think that caused some confusion for the schools in terms of, are we still operating? Who should be referring to us? And so we went, I believe, like September, October, November with very minimal referrals, and we could have been serving kids during that time. Then we got slammed with a bunch of referrals in November. So that definitely plays a role in the number of kids that we were serving.
Okay, just want to make sure my math was a bit off. I missed a decimal place. So that's 3,000. If we served with $150,000, if we served 40 kids, that's $3,750 per student served. So just to make sure that we're thinking about those numbers. Okay.
Just another quick follow-up. What do you think is the total number of kids in Douglas County that are needing these services? And I recognize you can only work on those that get referred, but you probably have a general sense of that. Like what percentage of the work is being covered versus kids that need those services still?
A lot more kids need services. A lot.
You mentioned that the courts have been making more direct referrals, which, I mean, I don't want to put words in your mouth, but basically, read in your narrative that that's maybe a little bit of mission creep, not exactly what your intended focus is, but you have been taking on those referrals. Has there been any conversation about direct cost and payment for that, reasons for those increased referrals? Are you in communication with the courts, maybe as part of the truancy conversations? And O'Connell, feel free to jump in too if you have any input specific with court referrals, but just help us understand that more.
I think the severity of the behavior that we're seeing in our truancy program is way more than what our program was originally designed to address. So I think the court is using our program as more of a treatment, a behavioral treatment program, more so than a truancy program, because they don't really know what to order for these kids. And so I think, that's a huge part of it. And obviously those kids take way more of my time and my resources because I'm the one working with them, and we have to kind of limit the mentor's role working with them. But yes, I think that there needs to be more conversation about how can we expand this truancy program to provide more intensive behavioral services for those kids.
Is there any money connected to court ordered
Not that I.
treatment, if we're calling it that?
Not that I'm aware
Okay.
of.
Just wanted to put a point on it.
I would say. Yeah. And Pam, you're welcome to come up here if you want to provide any clarity. We're seeing a large increase in students being referred to through the programs post-COVID and some of those resources. So.
We move to the CASA request, if that's okay?
Yeah.
Okay, so this is for 20,000 for a portion of a new position, the CASA supervisor. Where's the rest of the funding coming from?
Yeah, so our mostly individual donations. So part of our fundraising plan. So we didn't want to make full requests. We have a responsibility to cover some of the costs, and about 75% of our budget comes from individual donors and business sponsors. So. Yeah.
And you think that that funding stream would stay fairly consistent so that if there's a $20,000 ask this year, but it's an ongoing position, it would not be significantly higher in the future?
That's correct. Yeah. And we continue to work with a development consultant for the next year to continue implementing our plan. We've been kind of new. I'm saying we're new, even though we've done this for, 3 years, increasing our development work, but we're still learning how to do that. And our development director has done an amazing job, and we've hit our quarterly benchmarks for the past 2.5 years. So kind of expect that to continue. And so, yeah, generous community, Douglas County we're lucky to be here.
So I'm just going to confirm something I read in the budget book. You were funded by the city in 2020 and 2021 at $20,000. And your request to the county is for $20,000?
It is, yeah.
Okay.
Yeah.
So just so that everybody hears, we continually, this is the third one today where we have cut city funding, and now we're coming to the county to ask for funding for something that the city cut. And I understand it may be
And I think that's just a
different.
consequence or coincidence, because the 20,000 we have, covered, that was covered by the city with the individual fundraising and some other grant funding. So we got a VOCA grant that helps cover some of that now. So this is a supplemental to expand our current staffing.
Okay.
And you have a significant deficit budget this year. So it's drawing down some of your reserves.
Correct. Yeah.
Is that, what's the plan for kind of making that whole for the future?
But we purchased a building, so that's a huge part of that. We spent just purchasing the building was $575,000. And so that was a large one-time expense that is not going to continue. So that's the big part of that. And then also a piece of that is probably our investment that we pulled from our strategic investment funds to pay for our work with our development consultant. So the board is committed to using our investments to pay for that.
So I see that rent went to zero, but there's nothing for debt payments. Did you buy that building outright or are you servicing
Did.
debt?
Yes, we
Okay.
were exceedingly
Thanks.
lucky. Mr. William Dan, named us in his will, so we were able to buy that.
Thank you.
Any other questions for CASA? Okay. Maybe move on to O'Connell. I had a question for O'Connell and I'm going to sound like a broken record. So in 2020, you had $25,000 that came from the city that no longer comes from the city, and your request is for $50,000. Is this to replace that funding? Is it completely different? Can you tell me how you absorb that funding cut and how this relates, if at all?
So we had a resource management program that we did through the city funding, and that ended several years, ago, and we weren't looking to replace that. The 50,000 was the 50,000 that was being held. It's the same situation as Center versus Board.
And so that's not really in our
No.
options, right?
Yeah, we
Okay.
just wanted to restore back to the original amount.
Yep.
Is all. And then we turned it in before that.
Good, thank you. Megan, thank you for being online. Oh, good, excellent. So, I asked Bert Nash about their governing structure and part of it is because they receive such a large portion of their funding from the county. Your organization receives 70% of their funding from the county. Can you talk a little bit about your governing structure?
Sure. Can you hear me okay?
Uh-huh.
Okay. We have an 11-member board of directors, and 6 of those are at-large members that are just truly part of the Senior Resource Centers Board's recruitment process, and 5 of them are county appointees that the county has been wonderful to work with us to help make sure that we are filling the needs of our board of directors. We've got a board matrix that identifies areas of specialty that we're looking to fill, and the county commissioners, you've all been wonderful at working with us at identifying people to appoint to those positions that help to meet those goals.
Have you had, it seems like a large part of your cost is vehicle transportation, right? And it's really drivers and vehicle maintenance. And I think I'd just like to continue, and maybe this isn't the place, it's a later conversation, to have a conversation about an organization that gets such a large amount of county dollars and is asking for essentially a bump in pay for a certain level of workers. Where is that tipping point where we start to think of Douglas County Senior Center as part of Douglas County, right? We've got a lot of requests this year of, pay is going up. When do we move from being a community partner to being part of Douglas County? I don't have the answer to that. I think it's something that this commission has talked about quite a bit. But it's just something I'm thinking about as I look at another request for budget increases. Has your board had any discussions about that at all? And sort of how does it impact your organization to stay independent but be reliant on the county for so much funding?
Well, if to address just the your mention of Senior Wheels in regards to the county aspect, our Senior Wheels of Eudora and Senior Wheels of Baldwin, they both use volunteer drivers at this time. I'm not sure if that is the right solution to have volunteers doing that work forever. We've had some conversations about that, but at this time that continues to work, which is a great cost savings for us. But the vehicle that lives in Baldwin and the vehicle that lives in Eudora are, of course, have the same level of maintenance and fuel and all of that stuff as all the other vehicles. They also benefit from the dispatching and the oversight from the 2 office staff, the administrative folks that work in Lawrence at our Lawrence building. And the other thing just to be aware of is that because they are volunteers in Eudora and in Baldwin, they don't have to answer the call when there is a need. And so our Lawrence team of drivers basically fill in, if you will, for Baldwin and Eudora's drivers when they're unable. They're retired and they do want to go on vacation and they get sick and all of those things. And so the Lawrence team of drivers that are the paid staff, therefore obligated to come to work, cover that for us. And so there's a really good coverage of the county in that regard, as well as the Lecompton area. Doesn't have its own. And so of course that's our Lawrence team covers Lecompton and all of the rest of the county. And we do quite a few rural rides at this time. I don't have that number in front of me right now, but if that's something you're interested in, I'd be happy to have you do it. Our board of directors has not specifically had conversations about staying independent versus becoming a part of the county itself, the county structure itself. If that's something that the county is interested in, then that is a conversation we can start to entertain.
Okay, thanks.
Thanks for being here, Janet. Thanks for joining us online, Megan. I'm just curious, so you get a little bit of money from the city of Lawrence, but none of the other municipalities in Douglas County, correct?
No, that's not true. We get a little bit of money from Baldwin City. We get $4,000 a year, and that specifically is to help support the Baldwin Senior Wheels program. Eudora, it's a little bit more nuanced. Before Barack left, he and I had a conversation about support from Eudora because we had expanded our services specifically in Eudora. And at that time, the Eudora budget was not in a place where he was able to specifically support the Senior Resource Center and the Eudora Wheels program directly. And so instead, the Senior Foundation of Eudora, which is an amazing group of seniors that are out of that community, they received some funding from the city to support their senior program. And they in turn have so far given us a couple of $1,000s each year to support Senior Wheels. In addition, the Senior Foundation of Eudora does additional fundraising to help support the Eudora program. They've been heavily invested and very excited about the new vehicle that we are anxiously still awaiting to come from KDOT. It's been 2 years now since that grant was approved, but we still have not received a vehicle because of the COVID-related issues in vehicle manufacturing. Baldwin's vehicle is also still pending for the same situation, same reason, only theirs is going on 3 years. But no, so both communities do support the program in that way.
Okay, thanks. So I guess, well, the Senior Foundation, I would assume money from that is in the either fundraisers or contributions line.
Yes.
Is that where you're keeping the Eudora money too, even though it's coming directly from the municipality?
The Baldwin money, no, that
Or Baldwin money, sorry.
Yeah,
thank
that
you.
is in our city. That is in the how do you guys have it phrased? Let me.
I see City of Lawrence line, United Way line, grants, fundraisers,
Oh, you're right.
contributions.
Then I do have it in
In the
fundraising.
narrative, I think.
Mhm.
Oh, okay,
Yeah,
then
mhm.
I missed, thank you.
Yeah, I
Commissioner
dug it out
Kelly.
of there, but yeah, it was. hidden.
Okay,
sure.
thanks. I apologize for missing that. I just want to get a sense of what other local governments are investing in, is in particular, your organization and the Senior Wills program is so visible throughout the county and does a lot of constant place-based work throughout the county. I just want to make sure that those conversations are happening with municipalities.
Absolutely. And I just want to interject and just make sure that it is also recognized that although the city doesn't give us a lot of cold hard cash, the building that we are in is on a $1 for every 10-year lease. So the city contributes significantly in that way. And so that's also a big help.
Megan, I'm obligated to say that the county pays that portion for your city building.
I was not aware of that.
Yes, you're welcome.
Thank you.
There's a theme today. Okay, anything more for Janet or Megan?
It's actually a little bit for Sarah. Is that a number that we could capture at some point in terms of like total support for Senior Resource Center, what the county is covering for the building?
It's in our CIP, so I could show
I
you.
just got a copy of that today.
So, yeah, so that's that long, like 2027 payout on Fire Station 1, and we pay 100% of the costs for the Senior Resource Center side, and then 30 a portion of the fire side.
I'll look it up.
I
Thank you.
believe.
Thank you for sharing that, Sarah. That's never been disclosed to me.
You're welcome.
Any more questions? I'd like to move on to STA Care Center, and I see Jennifer is here. Jennifer, I appreciate the narrative that we got in the supplemental. Can you give me a little bit more clarity? I just didn't see exactly what services are being provided through that prevention program and to whom on your request.
Thank you. And thank you, commissioners, for having us here. Regarding the supplemental request, I did send an updated version that identified that VOCA funding was cut. However, SGF funding was made available for organizations to make up for that 40% cut. And so the focus of the request was on the prevention work. We were able to secure through grant funding, through federal and state grants, the underserved and rural community populations that we work with on a regular basis in particularly Franklin and Jefferson County, but that doesn't let us focus so much on Douglas County. And so those prevention efforts are being expanded to include, if you're familiar with the Safe Bar program, to include businesses, as well as focusing on our aging population, particularly here in Lawrence, which is growing, as well as disabled populations. And so creating accessible materials that are written at a basic reading level, for example, is one element of that. And then providing community trainings. A piece of this we are hoping will be someone that we can at least have part-time to be able to do those extra trainings that we foresee occurring and are already being requested. So I would say that the materials as well as the time of a trainer, obviously $5,000 is not going to cover that. But we hope to piece together several sources to make that happen.
Jennifer, I don't think we have that. I was asking Cammie. You said you sent us additional materials.
I can look that up.
Can you resend it?
Yeah.
And we'll just make sure the commissioners have it.
Yeah, absolutely.
Do you mind highlighting a little bit? I think it might be a specific project grant funded project, but maybe I'm wrong about that. Just some of the housing prevention or homelessness prevention and housing research and outreach that and prevention work that your organization has done specifically.
Yeah, we're one of 4 communities around the state that have primary prevention funding through KDHE. And so our staff member Gabby has been focused on those primary prevention efforts, focusing particularly over the last few years on homelessness and housing. We hosted the Midwest Academy last week. We now have a housing survey open and available that they will be using to kind of create a plan. Gabby cooperates with many of our various committees throughout the county that focus on these issues. So that has been a primary focus. Economic equity, sex equity and economics is another focus of that primary prevention. And so that would really fit in the business primary prevention trainings and information that we want to provide that is a mirror of Safe Bar. So those are two examples of that project. It has been a really great project. We have 2 more years, I believe, of funding for that one.
Okay, thanks. I just wanted to make sure I was clear about, like if that funding was continuing, and I knew it was sort of focused on some specific areas, but you have a slew of prevention efforts going on in different places that you just highlighted. So this $5,000 request to support some of the prevention efforts are not necessarily related to that specific project grant that you said is about 2 more years.
That's
left
correct.
of- Okay.
They would be associated, but they are not going to supplant any of that funding.
Okay, got it. Thank you. And you said VOCA was cut, but SGF, did VOCA cut your funding completely or by a percentage?
So something that has happened, I think, in most of the states in the country
Yeah.
is that VOCA funding was cut by 40%. Kansas was one of the last few states to experience that cut. For this year, we were able to get SGF funding to supplement and make up for what that cut would be. So that is something that is happened for anybody who receives VOCA funding within the state and will or will not continue to be funded by SGF.
Thank you. Community-based programs, right? Is that what you were going to clarify, Sarah? It's just the community-based programs that have had the 40% cut, not the systems-based programs, which is my understanding of it. I'm not expecting you to answer that, Jennifer, but I'm just making the clarification for the commission because we also have requests about system-based VOCA VAWA cuts that did not occur, but community-based has experienced cuts. Excuse me.
And I was just going to clarify, SGF stands for State General Fund.
Thank you both.
Thank you.
So can I ask about those funding? Are those still grants that you have to apply for and the pool of money has been cut? So it's just more of an unknown, or are those, have they told you like, we're only paying you out 40% of what you anticipated?
So I think generally speaking, they have been cut by 40%, and theoretically a program could or could not experience that 40% cut based on what they're requesting. But the reality is that because the governing bodies that disseminate that money are the same ones that deal with SGF, they are going to do more likely than not an across the board 40% cut.
So I'm looking at your budget breakdown, and your revenue is exceeds your expenses by a significant amount. Did you think of using, or is this tied to a matching grant? Why would we not use the balance of that for this?
I knew that you were going to ask me that because I listened to you ask other folks about that. Congratulations, Douglas County Commission. You got the first application I ever drafted as executive director of the care center. And so when I was doing this, I came in without a succession plan, without a lot of information. And so this was developed based on the information that I had. One of the things that is a major change is the salary amount, which is actually closer to $700,000. So that is the whole of our revenue. In fact, we have had to modify our other requests based on that.
Okay, thank you.
Kind of the paired conversation with that is that you have a fairly small fund balance in terms of covering salaries in an emergency or anything like that. So I did flag that too, but was less worried about it since there seemed to be a need in that unrestricted fund balance. But if there's a significant difference to the budget, is that something that we need to ask for with the salary line?
I would be happy to revise that.
Since there's been a significant difference in the salaries line item, I'm not sure that it impacts really the request that's had here, just as long as we know. So
That's correct.
Okay.
Yeah, if you want to send updated materials, we can get them to the commission.
I'd be happy to do that.
Okay. Any other groups you'd like to ask questions of commissioners? I think I've hit most of my questions.
So we do also have a VOCA request under the Willow. I don't know if Commissioner Reed gets to stay in the room for those questions or not. So that's why we save those for last.
Thanks for the opening. Commissioner Bailey. I will just state that I am an employee of the Willow, and these requests sort of directly impact my job, my day job at the Willow. So I'm just gonna not participate in asking questions or contribute anything to the conversation.
So just some general questions to kind of walk through the $50,000 supplemental request, which is also tied to VOCA funding. So it's kind of a theme, but if you talk about your particular circumstance.
Yeah, so similar to what Jennifer was saying, we are anticipating a 40% cut to our VOCA. We have requested some of that coverage through SGF, of course. We have not really heard definitively what our SGF coverage is going to be, or what our cuts for VOCA are going to be, but we are trying to mitigate those cuts as much as possible.
And when would you be likely to know for 2024 funding?
So SGF, we have applied for and are waiting on assurances now. Yeah, VOCA, we won't really hear about until basically October.
And I think there's a one-time funding request for 65,000 in terms of, it's starting up a new program. So talk to me about that and why that request is, why that one-time funding will cover it.
Yeah, so we have been working for a few years now with different agencies, law enforcement, the DA's office, trying to kind of come together in a more collaborative way to address domestic violence in the county. And so we have identified something called the Blueprint for, it's the Blueprint for Safety, and it is a national organization that helps communities come together, write policies that help to they create something called a high-risk team. The high-risk team has law enforcement, DA, pretrial services, advocates like us look at high-risk cases for fatality. And in essence, we try and make sure that we're not dropping any balls in these cases so that people are, don't end up in a fatality situation. With that in mind, that means there's a lot of policy rewriting. So what Praxis does for that money that's coming in that we're asking for, it's a training situation. It's about 18-month to a 2-year process. They come in and they send trainers that are specific for each agency. So DAs would train DAs, law enforcement would train law enforcement. The Willow has already secured a position that is going to be kind of the convener of that group. And so we did that with a Stop VAWA grant. So we have made significant strides, not only in getting the other agencies to agree that they want to do this work with us, but also we have the staff in place now to get going as soon as we can get the trainers to come in and help us with the process.
And this is a one-time request.
That is a
Right.
one-time request, correct?
And it said in the narrative that the budget was attached, but I didn't see it in that for that program. Yeah.
See if we can dig it out.
Yeah, that'd be great. Okay.
If you can't find it, I can resend it.
Okay. Anything else? Thank you all for being here. We appreciate your time and for answering our questions. We are going to take a 10-minute break and be back. All right, we are back. It is 11 o'clock. This is our final session of budget discussions. We will pick up again on Monday for our deliberations, but right now we're welcoming our Health and Human Services group in. And who's kicking this overview off? Jill.
Commissioners, this amount for this chunk of the budget, that 13.08 million that we're talking about this morning. What we're going to talk about now is approximately 9% of that, or 1.1 million. We're talking about the Lawrence Humane Society, Lawrence Community Shelter, Just Food, the Lawrence Douglas County Housing Authority, tenants to homeowners, and not reflected in that 1.1 million is that what we'll be talking about today is a request from a new partner, new but not new, new funding request from the Salvation Army. Just to highlight supplementals that are within that within this this group of agencies. I'm going to start with an agency that I didn't mention that we are going to talk about today, an agency, a department that is best suited to talk about along with these other partners, and that's Douglas County's Housing and Human Services Department. Gabby Sprague's here, who manages that program. A supplemental request has been submitted for $68,935 for a part-time employee to provide administrative and direct service assistance. Gabby's here to talk about some of that in greater detail, but that helps it build some additional capacity for the work of the Housing Stabilization Collaborative and the rent and utility payments that she's managing right now on her own, along with some support from an AmeriCorps worker and some of the Douglas County Administrator's Office admin staff as well. She can talk more about that and some of the grant funding that the HSC, the Housing and Human Services Department, brings in to bolster the rent and utility assistance, and then some of the other projects that she's been working on. Just to highlight one, tenant right to counsel is one that's I think we heard about earlier this week related to the District Court Self-Help Center. And then I mentioned a new agency request, and that's from the Salvation Army, and that is some additional materials were handed out that were not, from a timing perspective, they weren't available to go into your book, but Lieutenant McClintock is with us today and handed that out and can talk in greater detail about the $1 million one-time supplemental request related to their capital campaign. And that's in relation to their new building at 1202 East 23rd Street that have a total estimated cost of $6.5 million to renovate that space. And he's here along with some other members I see of the Salvation Army to speak in greater detail if need be. Those are the supplementals. I'm happy to answer any questions if I can about any other agencies, but you've got a really great group of folks here that I get to work with on a regular basis. And I'll open up for questions.
Thank you, Jill. Commissioners, as is each one, is there one you want to start with?
I'll start with our human services, unless someone else wanted to jump in. So for the new position, so it was mentioned that you're doing quite a lot of the managing for the HSC funds, along with an AmeriCorps volunteer. How long does that position stay with us? Do we lose that, or is that something that can be replaced?
We're losing that position at the end of August here, and it's not being renewed.
Are there any other options or programs that could fill in with that need for assistance?
I have thought about using or working with Bob Triansky to develop a peer support program with Douglas County Housing and Human Services. I got a little bit of pushback regarding the need. I need particularly administrative capacity, and the peer support program may not be best suited for that. However, that is one thought that I had in providing additional capacity, although it would be different than what I'm requesting here.
I would also add that there's been administrative support from administration as well. So we've got some people helping Gabby out too.
And that's what I was going to ask next, actually, is how many hours does that entail? Is that something that would then not be needed if there were another position? And is it currently a burden to administrative staff to fill in that, or is it just part of the work?
I would say that's a difficult question for me to answer right now. The amount of support that I've gotten from the administrative, Douglas County's administration is kind of, we're teaching that, or me and Jasmine, the AmeriCorps member, is teaching that currently. So I'm not entirely sure off right now. However, I am looking to use them more and more as we continue along.
You know, I'd say I don't think we have it down to hours, Commissioner, and I don't really ask her to track it that way. But I don't think it's been a problem. And I don't anticipate it would be an issue to continue to provide some support.
I just add, Gabby gets asked to participate in a lot of work groups too. And she's pretty good about policing her time to focus on administering the HSC. It takes up a good amount of her time. And the AmeriCorps worker helps supplant that and provide backup to that. And we're doing some necessary work to provide some more backup support and just the administration of some of the ongoing, not just paying bills that we get admin team here to help with on a regular basis, but also just running the lottery. Gabby, and that they do twice a month. And, the amount of time that entails with Gabby and facilitating conversations with the partners, problem solving, and then being asked to participate in some of the other collaborative efforts that are happening in the community. She gets pulled in a lot of different directions.
Are there pieces with the lottery especially that could be streamlined so it's less labor intensive, automated or anything? Or have those things already been done?
We are working with Douglas County IT to develop a tool that would make things a little bit more efficient. However, we do have to use a third-party service in order to ensure randomness in the lottery. You can't actually do that. I could get into the specifics of what an actual random number is, but you can actually do that with the Douglas County IT tool. So that will continue to be a part of the process that takes a lot of time. I would say from running the lottery through sending out the applications, it's going to take about 3 days, I would say, just by myself.
Now that ARPA funding is kind of running out for that, was my assumption. What funds did you have to distribute previously versus into the future?
The HSC has only been around since the beginning of the pandemic, so it's primarily been ARPA funding. I would say now we currently use community development block grant funds through the city of Lawrence. We've received almost half of the funding through the Affordable Housing Advisory Board for the last 3 years. We also use the Emergency Food and Shelter Program from the United Way of Caw Valley. I feel like I'm forgetting something, but.
Gabby, real quick, I'd want to add, prior to the pandemic, Douglas County was through the Emergency Services Council framework, which was an old framework that precedes all of us here at the table. I think it was hard to even find some bylaws to understand it, but the Emergency Services Council, the county was contributing $65,000 total for rent and utility assistance. That was split amongst 5 organizations. When I said Salvation Army is not that new to us, Salvation Army is one of them. Willow Domestic Violence Senior Resource Center, the Salvation Army, and the Ballard Center were the agencies that was split amongst $65,000. Then the pandemic happened. Some great minds came together in Rebecca Buford and Dana Ortiz to create the Housing Stabilization Collaborative. Gabby came on the scene and emerged as a leader in administering that when she was an AmeriCorps worker at the United Way. And here we are today. Those dollars have gone away from ARPA, but the county has more than, I think there's 6 times as much money as there was originally now from an ongoing basis from Douglas County. Then you add in what Gabby brings in from writing grants through the Affordable Housing Advisory Board, United Way. And that's something I didn't mention, the time and effort that it goes into writing those grants, submitting the reports, the compliance of that. She's doing her level best to try to bring in more money for our budget till it goes even further.
And something else that I would add to that is that I'm kind of a pessimist. I'm gonna say that before I say this, but in the last Douglas County newsletter that we sent out, we noted that we've provided $452,000 to about 430 households from January 1st through June 21st. However, we've received 912 applications totaling a requested amount of about $1.2 million. So the need is very great. And like Jill said, I spend a lot of my time doing a lot of the resource development that involves a lot of those grants. And I would like to be able to go after more grants. However, I just do not have the administrative capacity by myself. There is HUD COC funding that we could go after, but as we know, federal grants take a lot of administrative work. And I would like somebody kind of dedicated to the HSC. That way I can go after some of these bigger fish.
So.
I guess I
yeah.
feel like I appreciate that, Gabby, but I don't have anyone dedicated to grants countywide. So if we were going to look at expanding capacity for grant writing, I would want to look at it in terms of the whole county.
Another thing that I would like to note is that we did receive Q2 eviction numbers just this morning from the clerk of the district court. There were 224 evictions filed in the Q2 of this year, totaling 467 evictions filed in this year. At that rate, we're looking at a 60, if that rate continues, we're looking at a 67% in eviction filings, 67% increase from the previous year. I also want to note that the percentage of those filings that end in an order of restitution or someone being forcibly removed from their home is 44%, and that's maintained level through this year and last year. I think that every dollar we spend on prevention is going to, Jill shared the numbers from the emergency services and the funding that Douglas County spends on that. I think every dollar that we spend in prevention is less money we have to spend in the future.
I was going to add to, when we talk about the value add of our program and Gabby's work to bring in more resources, it's a value add to all the agencies that participate in the in the Housing Stabilization Collaborative. It's less funding that they're theoretically they need to raise out of for their own budget. For rent and utility assistance for their clients specific to their agencies. We consider it quite a huge value add to our human service agency partners in the community.
Gabby, I was excited to see in the narrative some discussion of self-help desk. I don't think I've discussed this with you, but Jill and I have had discussions and even toured a little bit of another community who provides sort of events that people can come to that have utility departments there, different resources there. That may not be what you're thinking this is on the self-help, but it's something that I'm interested in on how we create sort of a one-stop place for people to sort of understand what resources it is, because it is a complex web. Do you think this person will do maybe not that, but some of that work, or is this just it? Is there prevention work, or is it just allocating these funds?
I think there's definitely room for additional prevention work.
Okay.
Gabby, can you just help me understand the, excuse me, the professional services line? I think like you mentioned a third party. So we're seeing that professional services for for housing and human services department, it's up in the last couple of years, and maybe part of that is the third party vendor for the lottery. But I just want to understand what that's paying for and what it's contributing to your administrative capacity, or maybe how that's
Jill might be better suited to answer that.
We put that, and that's a number that we put initially in her budget for miscellaneous things that we didn't have really anticipate what this budget would need when we first proposed this. So that those funds, I think in a lot of ways they can shift into additional money for rent and utility assistance.
So this line item represents the funding for the housing.
Okay.
Housing coalition.
I was wondering.
Oh, for this year. You're right. Sorry, that is the number. That is the number.
Okay, yeah,
Sorry,
thank you.
that's where it
That
was
a,
initially. I
uh,
apologize.
A hole for me that I didn't see quite where that was. So that's where we put that. Yes, salary.
Okay.
Okay, got it. I just wanted to know if you, okay, never mind. Just
Now it's a
blows all the other
contract,
questions
yeah,
out of the water.
with
Thank you
Statewide
for
Homeless
clarifying.
Coalition. Sorry, confusion on my part.
Yeah, that line item is currently, I think, only $8,000 to account for the AmeriCorps member that we're no longer applying for.
Okay, any more questions for Gabby or Jill? Okay. We don't have any supplementals here, but we do have a new agency request. Salvation Army is, gotta pull it up in all my paperwork here. Do we want to talk about that one a little bit?
Why, yes, we do. So you've purchased a new building and then the funds are requested for renovations. And I have the total cost, if I can pull it up, as 6.5 million for the renovations. And a $1 million one-time request from the county. What other funding sources are you looking into for those, for the rest of the 6.5 million?
So we will be going out to the community and we've just finished a feasibility study that happened over the course of the last 2 months or so through interviews with community leaders, gifters that often give here in Lawrence. And a new feasibility goal, we believe we'll be able to raise 3.7 just with the gift base. Past that, we see going out to other foundations. Other than that, a lot of that will just be through donations from a excited giver base.
Do you have some of those foundations kind of already identified?
Sunderland will be going out to find more. There's a few that we use, Salvation Army here in the Midwest, but by name, I don't have that list right now.
It's something that we've been asking for other partners that ask for capital projects to see where else they're looking for dollars. So, and we can understand like what portion of that is being asked from Douglas County. So is that, if those have not yet been identified, there may not be much more you can share with it, but if there's some other things in the works or have thoughts, I'd like to see that.
Yeah, I would be able to get a name of people we plan on asking or particular groups that would be involved in that conversation.
And what's the timeline for the renovations?
So we will be going into a capital campaign or a silent phase this fall. Ideally, this will be a campaign that goes over the course of 2 years, starting renovations. The end of those 2 years, beginning of $2025.
You want, Commissioner, do you want that follow-up by Monday or do you got what you need?
Well, I guess I'm looking at the funds, if they're like starter funds for that campaign is one thing, but it looks like the funds probably wouldn't really be needed until the 2025 budget. So I was just curious why the request is for 2024.
By the end of a silent phase, we would be able to start renovations after we receive 75%. So those renovations could possibly start much sooner than that if we were able to raise the funds.
Thank you.
So I just want to make sure we're clear. We haven't started a capital campaign at all yet.
Yes, but we are prepared to start one this fall. We just finished the feasibility study.
So is Douglas County the first ask of your capital campaign?
They will be, yeah.
Well, there you are. Yes. Okay, that's happening now. And do you have any, usually in a silent campaign, you have some large donors who have made significant contributions to encourage smaller contributions. But if the total project is 5 million and you don't have anything yet, but you can start with 75%, you would need about 3.5 million by the end of 2024. Is that what you're projecting?
The minute we would have that 75%, we can start those constructions. To finish, we'd need the whole amount, but we would be able to start on some of those programs can happen before the end of the campaign. That would ideally happen sometime part of our public asking, which would be later into 2024, late 2024. Early 2025 is when it would go public.
Okay. Any other questions? Any other questions for this group?
I guess I'll just give you a chance, 'cause we also have some great materials that you brought to talk about the community asset that comes from the building and the building remodel. If you could just talk a little bit more about that.
So part of this remodel includes a commercial kitchen and a dining hall space. Ideally, this will be a space for the entire community and city to be able to take advantage of. So other agencies would be welcome to use this. We would have office space available to them. Our kitchen would be able to be run 5 days a week, serving meals. We continue to do that right now, but our current program would be able to be expanded and be much more comfortable and efficient in a kitchen that would be proposed in this capital campaign. Along with that, having a comfortable space on the east side of Lawrence for a navigation center. Those might have been terms that were seen in part of the strategic plan that are going forward that we work with other groups. The Salvation Army would use this space for case coordination, for an entry spot into homeless program. But outside of that, increasing our effectiveness using our EA offices, and then also Pathway of Hope case management and our food pantry would be expanded using this too.
Would there be like daily meals served there, or would there be meals served that would also be, eaten at the dining facility there, or would they be shipped out through other partner organizations?
So over the course of the last 2 years, we've had our Beacon of Hope canteen, our food truck that serves 3 days a week right now. That would be additional to whatever program we have here. I think we will always use our canteen to its best effective use. So we will go to camps for people that wouldn't be able to come to our building. But it would be, in addition, we would be able to serve meals inside.
Last question, in terms of square footage from the building you're coming from into this building, what's the comparison?
I believe we are about 8,000 square feet more in this new space. The new building that we're in, or not necessarily a new building, but the space we're able to use right now, it's on 23rd Street on a bus line, which has been great. It's outside of downtown, so parking is no longer an issue. But overall, our programs have been increasing because of our location. We're reaching more of the more demographics.
So
Yes, we took a campaign in early 2000s that we raised. We have $1 million towards this campaign already internally from a campaign that happened in the early 2006, I believe.
Landon, I'm surprised to hear you say that your location has been more of a benefit than your older location. That just works against my general knowledge of those who are needing services going out to 23rd Street versus where you were previously located. In your narrative, you described how many families and individuals you serve. Do you have details of how many individuals you serve at your current location versus the food truck versus assist? I'm interested to understand, since this is a capital campaign for a very specific building, how many people you're serving at that location. And I would be very interested to understand the difference in how many you serve at that location versus the location that you previously had. That's not included in here. If you could send that to me before Monday, that'd be really great. Yeah, thanks.
And if you have any details of money that was raised that would also work towards this capital campaign, I'd like to see that too.
Anything else, commissioners? To our other partners, thank you for being here. Appreciate you being available for any questions we might have.
If there's nothing else, Sarah, do you have anything else for us?
Yeah, I think we should talk a little bit about next week
Okay.
and kind of, but we can let these folks go and if we want, and then we can talk a little bit about next week.
Sure. Thank you all.
Thanks. Hold on. Salvation Army, capital, retail. And service. Is it in their packet? Do they have it? I know, so
I
but did
gave
you
it to
give to
them,
know?
yes.
Okay. That's, I guess what I'd like to go through is what commissioners, what follow-up we've already given them.
I've got some to give them. Do you
Okay.
want that?
You want to, yeah, you
I'll
want to
have
talk.
to go get it.
Okay.
Commissioners, I have some answers to some of your questions that I'm going from previous days' hearings that I'm going to give you.
Why don't we take a 5-minute break and we'll come back at 11:30 and get started on that portion?
great.
Would that be
Sounds
okay?
good.
Yeah. I'm going to move to the other side of the table.
Okay, we're back. It's 11:30. And we're gonna wrap up some things to prepare for our deliberations on Monday. But before we do, we think we have someone online, one of our community partners who is.
Yeah, Andrea, you raised your hand. I'm trying to promote you to a panelist. Do you have a question, Andrea?
No, I must have accidentally hit it moving my phone. I'm sorry.
Okay, cool. All right.
Thanks for being here.
Yeah, of course.
Okay, commissioners, Cammie and I have some initial follow-up items. So I'm gonna let Cammie explain what she's gonna hand to you. And then on the microphone, so you just tell them what we already have.
Okay, I have the feedback from the historical partners about the Haskell Cultural Center and their prioritizing of their supplementals. Did you want that read or just?
We'll just pass them out.
Okay, so we'll pass that out.
List them all.
Peasley Tech has responded back about questions about their ask, so we have that to give out.
Yeah.
I did find the last time IT staff was added to the county, and that was 2013. One position. And the district court gave us the backup information for the eviction diversion coordinator request that was asked for. That's the information I have right now.
So commissioners, next steps involve, we will distribute the commissioner worksheet electronically so that you all have a copy of that. In the past, what we've asked for, and this, we can discuss what works in terms of timing. If you can get us your initial thoughts on the worksheet by, Sunday at 5 is what we've said in the past. But I think Cammie will probably try to come in early that morning to get everybody on this, get those spreadsheets merged before our 9 o'clock session. So does everyone feel like they can do Sunday night? Just don't bring it in at 9 a.m. on Monday morning. And then, and just to note, commissioners, if you have questions on how to walk through that, we can certainly talk through that. And I don't know, Cammie, if you, do you have it so that I can pull it up since I'm in the panel. If that's helpful. And just because I think if you're going to try to do one-time requests, like how do we want them to know one-time requests? And then if the commissioners are looking to add a supplemental request, if you want to lower so that we don't raise the mill levy, we'll just want to make sure you guys understand where those pieces are. Would that be helpful? Okay.
Yes, I specifically want to, since there's so many one-time requests, understand what is easiest for you to have that noted. If we're supportive of it, but don't want it to impact the mill, do you just want us to put it in the comment box?
I think if
or-
you could take it out of just the additional funds that are outlined in the commissioner's budget, if you could subtract it, right? Well, can you just, I'll pull it up. Where is it at? Yeah, well, where is it at? Yeah.
So we're thinking about this. I think we also have to be clear on what's behavioral health sales tax.
Great.
How we, oh, okay. I think we need to talk about how we do behavioral health sales tax in that spreadsheet as well.
And I would also say that when you're punching that in, if you want to make it clear that it's coming from behavioral health sales tax, and you put a note on that, I will help you make sure that it is lined in the right column. But behavioral health sales tax will not make a mill levy impact.
But can we show that in 3 different buckets? Our mill levy impact, and then our one-time requests, and then our behavioral health sales tax requests?
So when you say buckets, what do you mean?
Well, I assume the spreadsheet is going to be doing some of the math for us in terms of adding up what we're requesting and how that impacts mill levy. I just want to make sure those one-time requests are not part of that equation, that are separately shown.
Yeah, so there's 2 ways. I want to walk you through how we do it. Okay. So, and Cami will just interrupt me if I get it wrong. So this is the County Budget Commission Decisions Worksheet. You each see your columns. Colors were not picked by any particular preference.
Can I have my name spelled correctly?
Oh, sorry. Apologize for that. 2 L's. Let's see. Enter and save. Did it not go? Oh, golly. Oh. I needed a cap lock. All right. So we start on this sheet, at the very top with administration. This sheet is in alphabetical order, correct, Cami? And then you see departments are in black on the side, and then community partners are in blue, just to help you organize your thoughts. Go ahead.
And it's alphabetical, beginning with all the departments in the general fund. So then below, which you'll get down to it, but
yeah,
you'll see more. This
And
is
then-
just,
And then column, go ahead.
I'm sorry. Help me understand the community partners line that's in
So that would,
black. That's just the total of everything in blue?
No. Yes.
Sum of everything that's in blue.
Okay, just want to make sure that we weren't, okay.
Right. So theoretically, if you wanted to give, like, let's say it still says KU Bioscience Spec Building here, so BTBC. Let's say you want to give BTBC more, you could add it on that line 17 here. But it would also, I'm gonna highlight it, it's gonna also eventually increase line 14 as well. So like this is the individual line, but this is a sum. This line is a sum of all the blue lines. On column Q here to this end, you see if there is a supplemental request, both either. So this should match the options page to the best of our abilities. Sometimes there's been it's hard to get everything on every page. Okay, so we're going to go through all the community partners. So then down here, where is commissioners? Are they-
Line 67 and 68.
Oh, gosh. Yeah, sorry. So here you see, what I would say is if you want, let's say you want to fund BTBC, you could add 50,000 on your line, and then you would subtract it, use a negative number on this line. And if you want to make a note, you can add that up.
And I placed those directions in the email to you
Okay.
on how you put the negative and positive in there to get that to happen. So you won't have to remember that from this meeting.
I mean, the commissioner's line, we would subtract the total amount. So for each of us individually, the amount of supplementals, for example, that we want to support and that we put positive numbers on those individual lines, we're going to add up all of those if we want to take it out of commissioner budget.
Correct.
Okay.
And then if you go down to non-appropriate, oh gosh, it goes back up. And I would just suggest, Commissioner Willie, that you make notes. They're generally commissioners find them very helpful. And so when we're walking through this part. Can I go past it? Non-appropriated. Or is it down below? Oh, there it is. So the final line before the bottom of the general line, the general fund at 115 there is, that is our reserves. So if you have a one-time request and you want to fund it from one-time dollars, I would show a negative number. I would put a positive, well,
Just a negative number to this will lower.
just a
fund
negative
balance.
number here. Don't put it, I mean, we'll figure out the mill levy. I'm just going to tell you that, you know, the formula here is around the mill levy. So if you, I would just use a negative number here if you're really worried about making sure the mill levy looks right for what you're trying to do. Because some of you may have desires of how low, if you want to lower the mill levy, what's a specific dollar amount you're getting to. Just know that we'll also check the math on next week and make sure we have it all right.
Cami, are you okay with us editing the formula so it pulls out one-time funds and pull, yeah, I think that, because we could create a separate page that sort of, a separate sheet that sort of totals up all those one-time funds.
That'd be great.
That's
Okay.
fine, yeah. And if you want to do like the buckets that you were speaking of, that's fine too. It's whatever explains to you how you can explain it to us. Yes.
Got it.
And what I would say, on Monday morning, we have an overview. Normally, we would have started with an overview presentation. I was hoping to end it with a summary presentation. I can walk commissioners through that PowerPoint at 9. And we can talk about some initial questions if Cammie's still trying to figure out some of the math before we can show this up on a screen.
So we had some additional requests for information from partners that were going to get it to us on Monday. That is information that I would like to be informing how I make these decisions. The timing is a little rough there.
It is. I don't know when they're going to get them to us, and I really don't want Cammie to have to work all weekend. So, you know, my thought was we will try to collapse that stuff on Monday and get it to you. I don't think we'll be done with decision-making on Monday. So hopefully if we get it Monday, you can get it Tuesday and you can use it to finalize. So if you have things that you're not 100% sure on, you can just sort of highlight it and we can try to come back on it.
Yeah, Commissioner Willie, I would just, my experience has been that this changes a lot for the next, but this is a starting
Yes,
place for
yes,
us. Yeah.
There's one other piece of information that I think we haven't asked for yet, and that is what would be the budget impact on Pam's staff if we were to change staffing or pay package for the sheriff's department, sheriff's office?
Yeah, and I don't have a number on that yet.
Okay.
You know, I don't have it, and I don't think I can have it by Monday.
And that would be the only other parallel staff that would kind of need to be adjusted similar to the sheriff's office.
Correct.
Okay.
You know what you could do, I mean, depending on how you want to look at it. You decide what you want to fund in terms of the sheriff's request. I would need time to study and evaluate what and how we would want to approach the correctional officers at juvenile detention. And then I think we'd probably end up having to pay for it one time in 2024. But that would come back to the commission as a decision. And then I could build it into 2025. But I don't have any way to necessarily allocate funds at this stage. I mean, it'd just be a guess.
Commissioner Kelly, I appreciate the ask about like a separate sheet specific to the one-time request. I want to sort of think out loud to be clear about that. So with anything that we want to support, but that is a one-time request, therefore we don't want it to impact mill levy, should only indicate it on this additional sheet that you're going to create for us, Cammie, and not put it on the line item here. So like, let's take a
I
quick.
think you can do it either way, depending on what you prefer. You could decide to subtract your total from this line, the non-appropriated line if you want, or you can just give us a spreadsheet,
And
you
then
know,
I'll just
and a
make the
listing and
subtraction.
she'll do it.
But also, if you scroll down, there's the mental health sales tax, and
Okay.
if you were to add, it's just one line, 125. If you were to add anything to that line, like you would want to add anything to that fund, it's going, this spreadsheet is built to show you a mill levy difference, and that's just not the case for that fund.
Right.
Yeah, we just have to go, I don't know how you set it up, Cami, but we'd have to see what the formula is to calculate and take a cell out.
Yeah, just
Of that.
delete that mill levy that would pop up.
Yeah.
And then I will make sure that you're not inflating the mill levy.
Yeah, and I'd say, you know, this is a really great tool for us. But it was built to really calculate mill levy difference. That is not necessarily the primary issue this year. Trust me, it makes it nice.
Yeah, it keeps getting more and more complicated, but a great tool. But I also see that it's helpful as a commissioner to sort of see what that mill levy is. And by adding things will increase the mill levy. So we have to sort of pull that out in
Mhm.
some way and attach it to the right line. So if it sounds like if it's around mental health, you want us to assign it to 125, right?
Yeah, or I didn't realize I'd already done all this work below it, but you notice all those
Supplementals to the side.
supplementals off to the right. If once you go and add it, if you just delete the mill levy it adds, then that tells us what we need to know for adjusting mental health sales tax fund. And it leaves you not inflating the mill levy.
Right.
That makes sense.
And
Does
you
to
can
me,
email me.
But
I'm available to answer questions by email, and I expect that there might be questions.
Yeah.
And that Monday is definitely a rough draft.
Yes.
Always.
Starter conversation.
Yes. Commissioners, do you want to stay down here on Monday? We could obviously get rid of the extra tables, or do you want to move up to the dais?
I'd like to be able to see each other.
Okay, which is hard up there. So we'll stay down here. Sounds good. Really appreciate commissioners' time and energy. I know it's been a crazy 3 days here in terms of the volume of information that's been thrown at you. I think it's been hugely helpful. I was thinking about this after some of the conversations we had with our targeted populations partners. One of the things I'd like to do next week, and maybe even in between while Cammie's checking math, you know, I've made extensive notes. I'd like to talk to the commission about like, while your thoughts are fresh about changes to either the book or the process, or if there are things that we want to follow up on that maybe aren't necessarily needed to balance a budget and adopt and set a public hearing date. But if there are items that we want to follow up more, things that we want to have additional conversations on, plan for the fall. So if you're thinking about some of those things, you know, I think those would be good to put in to the conversation next week.
I appreciate that. And, certainly I'm ready to look at multiple volumes for this budget book instead of one giant folder. But I think also I'd be interested in, and I'm not quite sure how to collect this, so I'll just put that seed in your brain, Sarah, from our community partners and our departments, how this process is working for them. This is something we've continued to refine over the past couple of years, and I always want to get their feedback. And that may be informally, and then you share it with us, but I recognize the power dynamic that exists in that space. And also I want to get feedback so we can make it better for everybody.
Is fairly minor, but I would love for community partners if the budget was the first page so that I'm not flipping because everybody has a different set of information they send us. Really, the budget, I want to read the numbers and then I'll read the words that go with it. So that's how I would prefer to see it. And then it's easier to find when we're sitting at the table too.
Okay.
I wish there was a way not to duplicate the budget option sheets. And I know that's tricky if there was a way to put it in with, especially on departments. So when we have county departments, you got to go flip to their budget option to their supplemental. It is included lightly in there, but the detailed, so we can just,
Yeah, it's
those are just
easy.
ideas.
Yeah, with community partners, it's together. I have very little ability to modify that form.
Okay.
That, if you want line item detail on departments, that comes straight out of our financial system and I can't modify
Yeah,
that.
I'll visit further. That's not what I meant, but yeah,
All
we
right.
can talk about it.
Great.
Yeah.
Thank you.
Anything else for us? Cami, Brooke? I just want to express gratitude for all the work that staff has done to get us to this point. We're only at the halfway mark, really. But it's a tremendous amount of work and just really appreciate appreciate all of our partners and department heads coming in and meeting with us.
Yeah, I just want to echo that appreciation both for the amount of time and labor and energy of both staff and community partners. But to me, one of the highest values of that is the transparency with which we do our budget process, how much detail and insight commissioners get to have and really sort of interrogate what our investments are and do that publicly with our community. I just think that's a cool process and appreciate that it takes a lot of extra time and energy and sort of exposure for both our community partners and staff to be having those transparent conversations.
Okay, if there's no other comments, we will adjourn and we will pick it up at 9 o'clock on Monday.